All right, and our next guest is Bentley Adams. Bentley is the founder and CEO of MealShare. Bentley, nice to meet you.
Nice to meet you too, Scott. How you doing?
So tell us about MealShare.
Yeah, it's a mindful eating app that connects people, consumers, to nutritionists who are all dietitians. And really what we're focused on is helping people listen to their body instead of doing a diet or calorie counting or something like that.
You talk about running contrary to the diet culture. Why is that?
Well, diets really have only existed since the late 50s. They're a human advent, but they have an 83% failure rate. That's well studied from UCLA, compilation study, big. I think that at the end of the day is the consumer market, anything that has that high of a failure rate, and at the same time where we have chronic disease levels that are 2/3 of our population, and the biggest single budget line items on our healthcare bill, we really have to figure out new ways. And as separate from my healthcare career, I found as a personal trainer that, well, if you're actually just asking somebody, hey, Scott, how was your day? What'd you do? How's the stress? How's the interview go? What'd you eat for lunch? By 5, 6, 7 o'clock at night, you already know if you ate something wrong. You just need to become aware of it. And so we need a new way, something that works and helps you eat for you and do it for the long term.
So I know the search engine results for nutrition queries provide only like 10 to 20% satisfaction. Like, why is it so bad, do you think?
Well, I think it's hard. I think Google does a fantastic job. If you think ultimately the big search engine, 92% of searches are on Google, right? It's a very big number, as David Feinberger will tell you, right? But I think it's really hard because Google doesn't have good personal inputs, and so it's really hard without immersive inputs to tell somebody about eating preferences or their health goals or what their basic biometrics are. It's really hard to tell them what to eat. And then as well as with the interaction model, what are they asking? What are their questions? So that's why when you go to Google, you type in any, nutrition question, why should I eat salmon twice a week or not? You're going to get 10 different results that say 10 different things, and they're all going to try to sell you something, or whether it's on a diet or whatever it may be. It's just not going to get you what you need.
Got it. And so how does MealShare, what kind of inputs does that app receive to tailor kind of your meal plan and the recipes?
It's really a lightweight user experience, and that's what we went for because that's what consumers are used to. And so we'll take in eating preferences, health goals, and then basic biometrics within 90 seconds, whereas a normal dietitian, initial consult will take 90 minutes, right? So we really try to shorten that process and get the dietitians what they need, but then also too for yourself, just to identify who you are for a social reason too. Yeah.
Nice. So I already brought this question up, but how do you feel is the best way to address the high risk, low income populations again who are eating fast food all the time because they just don't have the income or the time?
Ultimately, I think it's cultural. And that's why our main demographic who we're going for are moms, because moms make most of the decisions in society, both directly over their own families, but as well because food manufacturers design their food for their biggest audience, which are moms, generally speaking. So indirectly, we can help low, socioeconomic class or whatever it may be, or people that wouldn't otherwise have access to better food by changing what's on their menu through the economic power and buying power of a core demographic. And I just realized the healthcare system, as much as I love it and everybody in it, I think that this problem specifically around eating needs to be solved in the consumer market.
Got it. Very cool. Well, thank you, Bentley. It was nice meeting you.
Absolutely. Thanks, Scott.